the next presentation is by
celestial naughtiness. I always get a slot towards the end of the seminar where I have to deal with slumber of people and have the hall empty. Anyhow, those who have left, it is their loss. So as I'm introduced, I practice homeopathy in Oman. 1995, when I was leaving for Oman, my friends were of the opinion that Oman is an oil-producing desert country. Well, friends, Oman is in the southeastern area of Arab Peninsula. It is the closest Gulf country to India and has very close ties with us for ages. And recently the Sultan of Oman came to India and has offered a port to the government of India in one place in Oman. Desert. This is my Oman. Just a quick view. Blending traditional architecture with the modern architecture. As you can see, it's not just desert. We have beautiful pristine beaches. That's our beautiful green city of Salalah in the south of Oman. Another pic from Salalah. As for religion, it is very liberal country. In addition to many beautiful mosques, we have many temples, gurudwaras and churches. That's our Krishna temple. That's our Shiva temple. That's our church. So friends, 1995 was my journey from India to Oman. Oman was the first Gulf country to have officially allowed the practice of homeopathy, and I was fortunate to introduce our science in this beautiful country. Initial years of practice, was it easy? Believe my friends, it was not. Since people in Oman at that time did not know the homeopathic way of healing, I had to deal with lot of queries, lot of questions, lot of comments and lots of criticism. What the sweet pills can do. Promotion came on my shoulder. I was one of the first few homeopaths there. And the only way I could prove our science was by compiling cases, documenting my cases, and presenting my cases. I wrote articles in the newspapers, magazines. I gave interviews on Oman radio about what homeopathy is. Well, that is history now. 29 years down the line, homeopathy is a very well accepted way of healing in Oman. Not only among our Indian community there, even among the local Omanis, as well as multiple nationalities. I have more than 50 nationalities as my patients. As we all know, the basis of prescription by a homeopathic physician is always a reflection of the prescriber's interpretation of the case. Individualization has been the burden of the message of every great teacher since Dr. Hahnemann. We all get results, friends, in both acute and chronic illnesses using different approaches based on our clinical knowledge and experience. We have seen since morning multiple approaches in genetic cases, in behavior disorders, in fibroid, even gallbladder adenomyosis, wonderful result by Dr. Tanvi. But lack of scientific validation and convincing evidence of the effectiveness and safety of homeopathy has been a restraint in the acceptance of our science by the conventional fraternity in many countries. Fact is that various ailments, both acute and chronic, respond better to our homeopathy, as we have seen since morning in so many cases. Homeopathy has an upper edge over conventional medicine in management of many disorders where they have no results or no role. This is one of my early cases referred to me by our pediatrician on the 12th day of start of his symptoms. It's a case of infectious mononucleosis or glandular fever, as we all know, caused by Epstein-Barr virus. And the latest research says Epstein-Barr virus infection is very common. One of two people in the world do get affected by this, especially in the childhood, and it could be one of the major trigger for lots of autoimmune disorders we are seeing today. So the child was given antibiotic for his high grade fever along with his suppositories for fever. This is third day after starting the medicines. This is the fifth day after starting his medicine, and this is the seventh day. They have taken 12 days, made the child a mess, and within 7 days, homeopathy helped that child. The medicine given was acid phos. Why? Because when I examined the child, the main thing I noticed was the child was not responding to examination. Apathy and indifference, which is the key in acid phos, made me select acid phos. Plus, there were other symptoms present, obviously. Profuse sweat was there, mainly at night and in morning. We all know acid phos is used for low-grade fevers. His comprehension was almost absent. He was almost in stupor. So I gave acid phos 202 doses, followed by pyrogen. But why pyrogen? When I was sure of acid phos, I told this was my early cases. And pyrogen was selected as a pathological specific medicine. This case was referred by the pediatrician. I had to give results. As Dr. Borik has mentioned, pyrogen is our specific antiseptic medicine. So although the restlessness of pyrogen was missing, I still gave pyrogen as a pathological selection, but acid phos was on symptom totality. Result is in front of you. I'll just take a second hold. Friends, acute cases and quick results definitely make us and the patients very happy. And knowing to prescribe the right acute medicine is very important. Disposition of the patient and a change in psychological symptom is very important in acute stage too, not just chronic. Do these acute cases give us the real satisfaction of cure for which homeopathy is popular? I would say yes and no both. Yes, because the fast improvement in signs and symptoms, patient is relieved, makes you popular. No, as there are relapses. What is really required to get a perfect result in cases not responding to any treatment and finally referred to us? Friends, we have fixed principles of a science with multiple approaches, but we apply these in our own unique way, formulated through our individual clinical experiences, learned through our successes and our failures. Organon is the heart and soul of homeopathy and will always remain so. It will keep guiding us towards selection of the right medicine. Individualization of every case is of utmost importance, both chronic as well as acute. This 84 years old gentleman suffering from severe pain in toes and feet, which kept him up most of the nights, was sent to me, referred by a good friend, doctor. He had been treated by allopaths, Ayurvedic doctors, and homeopaths over the last 8 months. Diagnosed as lupus pernio, which is a cutaneous presentation of sarcoidosis. His daughter told me, doctor, he's a very positive person. But for the last 6 to 8 months, that is since he started his complaint, he has been calling all the kids from different part of the world. He has 6 children in different part of the world, and he want to distribute his wealth. Dr. Tanveer had taken a very extensive case, and that is the way to go to find the right medicine. But as I said, we all have different experiences in treatment, And that experience is used in different ways in different type of cases. Some cases we just need one sentence observed by the family member or observed by yourself or told by the patient. So what did this comment from the daughter meant? It immediately guided me to my rubric and hence to the medicine. If you see complete repertory, mind section, delusion, he is about to die, think there is but little time to make his will. There is only one medicine. Anybody knows which it is? That is petroleum. Petroleum is the major medicine for chilblains also, we all know. So his first visit was July 20th. That was his second visit. 3 weeks later, he was better. And this is 6 weeks after petroleum. No pains, marked improvement, not only in his skin, but at the level of the mind too. No more worried about his well. We all know petroleum is a carbon group medicine. The main logic behind carbon is slowness, sluggishness, laxness. But where does this come from? From low production of elastin, so relaxation of tissues. High production of fibrin, so hardness of tissues. Most carbons are chilly, thirsty, right-sided, crave for oxygen, they are money-minded. They have stasis running in them. When this stasis is in gut, it causes constipation, respiratory tract, it causes sighing, difficulty in breathing. Serious will slow the portal system, it will cause venous inelastic changes leading to varicosities, hemorrhoids. Excess fibrin causes hardness, so the carbon remedies are effective in corns and callosities, keloids, atherosclerosis, glandular swellings. Carbons have lingering complaints and are slow to heal. Usually they are worse in the evening, they desire stimulants, and they are venous bleeders. Now here our medicine was petroleum, another right-sided medicine, mainly chili, complaints during riding in a carriage, especially vomitings. They have confusion of places. Even in well-known places, they get confused. So it can be one of the major medicine for dementia, aging-related geriatric complaints, even Alzheimer's. Manage habit. I have selected petroleum on this simple single observation in girls. Manage habit, tomboyish females, but with timidity and bashfulness. Not tomboyishness with harshness, with bashfulness. Petroleum is the medicine. Perspiration on single parts, skin worse in winters, we all know that. Diarrhea, when it is there, it's only in the daytime. And occupational headaches and vertigo, especially occipital. So it's one of the medicine for cervical spondylosis and cervicalgia, which we are seeing so many number of cases nowadays because of computer use, phone use. So you can think of petroleum even in cervicalgia. Other carbon remedies which I use in my clinic are carboanimalis, carbovex, graphitis, carbonium group, and creosote. Now, aphorism 6 says, the unprejudiced observer takes note of nothing in every individual disease except the changes in the health of the body and mind. We have been hearing this since morning. Felt by the patient himself, remarked by those around him we saw in a case, and observed by the physician. So here goes a beautiful girl. Isn't she beautiful? But she was not like this. This is how she came to me. This is her first visit to me. What I noted during her case taking was an extreme despair as she was not getting any result for the past 3 years with any form of medication. She was even given high dose of vitamin E, the Accutane, which caused some problem in her liver. But the acne came back again. Her thinking was that she will never get completely okay. Very moralistic girl, will never do anything which is not correct. So never had a boyfriend, though she was approached many times. Would get tired easily, and on slightest of exertion, her hemoglobin used to be in 9 to 10. Doctor, nobody is there for me. Maybe cause I do not look pretty. So this was the first visit. This is 6 weeks after a single dose of Sorinum 200. 6 weeks again. This is 12 weeks, not repeated. Only the single dose of soranum is working. 12 weeks, that is almost 3 months. And this is when we stopped her medicine, she sent a photograph to me almost an year later. So, as we know, soranum, it's a great nosode prepared first by Dr. Hahnemann and later by Dr. Herring from scabies vesicle. We came to know about soranum post-COVID time because it was one of the main medicines for debility after influenza. I use it extensively in patients post-COVID. Feeling of isolation with deep anxiety and hopelessness. Loss of smell, suffocative morning tracheal cough, that's not important. Dr. Borik says it gives often immunity from cold catching. So recurring colds as an intercurrent medicine, you can use that. I'll just skip this because we don't have much time. I'll come to this beautiful case. It is very good case for learning, presented with migraine for 4 weeks, with weekly headaches and very upset. When I asked him about the skin, he was having vitiligo as is visible supraorbitally. So he was very upset. Doctor, I have come to you for my migraines. Please treat my migraine. Don't talk to me about my skin. So what did I notice with this one sentence? Lack of reverence. And then I noticed it was not only towards me, even towards his wife. Whenever she would add something, he would shoo her up. He was little loud in his talking. Wife told me, doctor, he spends a lot, much more than he make money. In both our daughters' marriage, he spent more than what was needed, even by taking loan. I saw a lot of egotism in this patient. I, me, mine was mentioned many times. I noticed he had despair of social position. How? He told me vitiligo started after he lost his first job and thus respect in the family. Headache started when he was not given the promotion he deserved according to him. He desired ice drinks and the wife said sometimes he even chews ice. Now the most important part which sealed my medicine selection was he told me, Dr. Sharma, after 1 hour of interview, when he got pallid with me, Dr. Sharma, I think you should change your religion. I said, sir, why should I change my religion? See, I also changed my religion. Why did you change your religion, sir? You know, God came to me in dream and asked me to. Now also, God comes to me in my dream and I guide people who are in trouble. This was the most important symptom which sealed his medicine. So this was the first visit. Another picture from the first visit. Friends, whenever we want to select a remedy, we have to see it from all the angles. Otherwise, we see different medicines from different angles. So in this case, I'll explain how I saw the medicine from all the angles. This was another picture from the first visit. Now, if we think of a remedy from the point of view of only the presenting complaint, arsenic album and calcare are covering both, but will they help? What is the core of this patient? Lack of reverence, egotism, extravagance, despair of social position. What is the keynote of this patient? Delusion about God. What is the striking physical general? Desire for ice and ice drinks. Now, when I take all the symptoms but miss adding the most striking general, we miss our medicine. What is the most striking general here? The delusion. Why this delusion is so important here? He changed his religion because of that. That is why it is most striking, most important. So if we not at that rubric, calcarea is coming as the main medicine. But when we add that rubric, delusion in conversation with God. Now, students, many students are here. Remember, delusion in conversation with God. Viatram album is the medicine which came up. But for delusion in presence of God, Hydrogenum is the medicine. So you have to be very sure what you're seeing in the patient and how you're converting it into a rubric. So Veratrum album here is not covering any of his physical complaint. As we know, Veratrum or the white hellebore, it is a medicine for collapse with profuse sweat. We all have studied in Materia Medica. But what is the core of Veratrum? As students, you should not only know internal medicine well, you should not only know your Materia Medica well, you should know the core of Polycrest very well. So what is the core of Veratrum album? Extravagance is the core of Veratrum album. Despair of social position is the core of Veratrum album. Of losing his position is present in Veratrum album. And the egotism. Even in a small child, small Veratrum child, when he gets a gift, he will make sure to show everyone, I got this gift better than yours. Egotism, it runs in Veratrum album. By the way, it's one of the major medicine I have used for autism or rather other pervasive development disorders also, including Asperger's. I, me, and mine is the main theme of Liliaceae family as a whole, including Paris quadrifolia, Crocus sativus. They have this theme, me, mine, I. So, Veratrum was selected, my friends, and this is the patient. No migraines, 32 years old vitiligo, the body cured within an year's time. The best part was, after he got better, he came to me with very big box of sweet, but still fought with me. He said, Doctor, I think your medicine works very well, but it's demonic. I said, why, sir? Why do you say this? He said, God stopped coming to me after your medicine. His delusion was cured also. So, what are the secrets of success, my dear young homeopaths present here? Case taking. Very clear instructions are given by Dr. Hahnemann in aphorism 84 to 104 and 153. Please do read them nicely and understand them. Evaluation of symptoms. How do you evaluate my symptoms, the patient's symptom? Doctor, my husband, every day he scold me, now, so I get angry. Is it a symptom? It's a normal reaction of any lady who is scolded. But doctor, I feel like taking a knife and stabbing him. That is a symptom. What she feels in the anger situation. So you should evaluate the symptoms very well. Then, most important is understanding the disposition of the patient. And last but not the least is patience to wait once you are sure of your selection. Give time for the medicine to act, especially in chronic diseases. Aphorism 7 says the symptoms alone by which the disease demands and points to the remedy suited to relieve.
Dr.
The
Deepak,
only
5
thing,
more minutes.
the only thing that can determine the choice of most appropriate remedy is totality of symptom. Now I have to go fast. This is a case of terminal gangrene treated with lachesis. This is my secretary's mother, almost ready to be operated, an Omani lady. This was the status when I first saw him. This is during treatment. Why I selected lachesis? What was my observation? This lady was a robust, well-kept looking lady with tattoos on her hands. She joked with me when I went to visit her. Although she's so sick, she knows she's going to be operated. Still, she was in a joking mood. She even told me a joke on the doctor who was treating her in the hospital. And the best thing which I observed was she enjoyed her joke herself, as if she's living that joke. Fun was in her eyes. It sealed my mind on lachesis. Still, I took her case fully, completely. Now, what is the essence running in lachesis? Usually, we look for loquacity, suspiciousness, dream snakes off, and heat intolerance for lachesis. My dear young homeopath, jesting, passion, and mimicry runs in lachesis. Amusement, desire for runs in lachesis. Now, it is different from entertainment desire, like in tuberculinum, pipermeth, cannabis indica. Entertainment desire means they feel good with entertainment. Amusement desire is when you live that joke, when you live that feeling. They enjoy thoroughly everywhere, playful even when so sick. Like in belladonna and cocculus, they are playful even when they are sick. They are curious, frivolous, and have traditional prejudice. This patient reached this stage because she had the traditional prejudice about local Omani medicine, which she kept taking till this became a deep ulcer. To cut the long story short, we have less time. This is 3 months after lachesis, 1M, single dose. Never needed an amputation. So this, we leave. This is a case of eczema, very interesting, suffering since 2 years age. Everywhere she had rashes on the body, very depressed. This was her first report I did in my clinic when she came to me. Her eosinophil count was 14.3, AEC was 2102, 1550 was her total IG level. Now, in selecting a remedy for a patient, we do not just note the exaggerated and inappropriate immune response, but also how it has affected him as a person. What helps us here is the change in the disposition of the patient due to the acute disease and the actual disposition when it is chronic. That is what Dr. Hanneman says. I will skip the pathology part. Her treatment journey, conventional antihistamine and local steroids, other alternative medicine. When we started her treatment, the second visit, her AEC came to 1010 from 2102. Her total IG came to 730. This is May when I made her medicine to placebo totally. AEC 235, which is normal, IG 100, which is normal, and this was the patient. She had suffered for 18 years with this disease. This is the patient. This is the patient. So if we go for case analysis, I will skip that. I'll just tell you I selected lycopodium on her symptoms, lycopodium 30 to 1M to even 10M. I gave her one dose over the period of 1 year, and arsenic iode 3x. Why arsenic iode when lyco was indicated? I did an in-clinic research on arsenic iode on 198 patients along with my internal medicinist who was referring cases to me. And we found arsenic iode is almost specific for eosinophilia, and thus it helps in allergies. This is a message she sent me when I requested her that can I present your case. So she writes, by all means, dear Dr. Sharma, if you want and it helps, I can even travel to wherever you want. My happiness today is a gift of homeopathy and you. Please go ahead and share my case. She is in UK and she is ready to come from UK. Now, none of my conference misses this case. One of the most beautiful cases of vitiligo I treated, and this case gave me the max happiness. Why? Because from 2 years age he started vitiligo. One of the richest families in Muscat. They had taken this child all over the world. The best dermatologists, you name it, in US, UK, anywhere. This child was treated. This was when he was brought to me, not for vitiligo. He was brought because of his oppositional defined disorder. As we all know, I didn't treat the ODD, I didn't treat the vitiligo, I treated him as a person. The case required me to take mother's history, where I found a lot of domination, not just during pregnancy, before pregnancy also, and after pregnancy during lactation also. Any guess about the medicine? Anyhow, so he was given carcinosinum 1M single dose here. This is after carcinosinum, 3 months later. Another picture from the same time. 3 months later, you can see the pigment developing. This is 1 year after the start of carcinosinum 1M, where 3 doses of carcinosinum were given till now. And this is the stage where I gave 10M. This is after 10M, a month after 10M. This is 3 months after 10M, where one more dose was repeated. This is where we close the case. So as we all know about carcinosin, I will not go in the detail, but know one thing. Carcinosin is made from breast cancer tissue. If we think of a cancer cell, initially it is localized in the primary organ, but as time progresses, it starts spreading, metastasizing, That is what happens with carcinosinum. The dome at carcinosinum changed to a volcano. That is what happened to this child. The ODD developed due to change from his doormat or mild or sensitive level to the reactive level. Oppositional defined disorder, it includes a frequent and ongoing pattern of anger, irritability, arguing, and defiance toward parents and other authority figures. It also includes being spiteful and seeking revenge, a behavior called vindictiveness. We can think of carcinosinum. It is one of the most commonly indicated medicine in today's syphilitic era. We can think of it in depression, fear psychosis, bipolar disorders, even in schizophrenia. So, we as homeopaths definitely need documentation beyond our clinical experience. It is my request to all homeopaths present today. We all get beautiful results. Please, please document your results. That is what helped me in establishing homeopathy in Oman. The doctors who used to laugh at me today, they begged me for an appointment for their children, all because of homeopathy. As research continues to expand, we will be prepared to meet the challenges and rigorous demand of the medical world. Time is not far away, as Dr. Rajendran showed what actually homeopathy is. Not even just nano, it's quantum. Time will show soon homeopathy's acceptance as a quantum medicine at every scientific level. Thank you.
Thank you, Dr. Deepak Sharma. Just give one more round of applause to Dr. Deepak Sharma because he sowed the seeds of homeopathy in Middle East.